For a few more minutes.
Go.
Recording.
Hello, everyone. We're recording. We are here. I'm Kass Thomas, and I am here with the lovely Dr. Glenna Rice. And I am so curious, very curious, and I hope you are too, to hear who is this Dr. Glenna Rice, who has been creating magic around the world for years, and it has not stopped. She's come to us with this new class called EMT. Now, I know that the obvious question to start with is, what is EMT? And I would love to know what EMT is, but what I would really love to start with is, lots of people know you. I have known you for years and enjoy your magic so much. And you have both magic and miracles and invite people to that, and a lot of technical knowledge. Can you tell us who you are? How did you get to be that, all that, please?
What a great introduction. How did I get to be me? Well,
Yeah.
We can start with my parents getting together years ago. No, I've been working with bodies for a very long time. I'm a physical therapist. That's what I got my doctorate in. And when I found access work, I added everything I'd been trained in and everything I'd gleaned from the bodies I'd been working on and what I was doing in my practice. And I added all of the energetic tools and processes of access to that work, and things started changing dynamically. And that was probably after my first, what was 2 and 3, which is now the COP class that I went to with Gary. And it was just like, wow, I remember doing this, it's kind of like the energy ball people talk about, but someone had shown me something where you take the energy of something and an energy of something else and put them together and see what it creates. And I remember taking the energy of all the body work, this fascial, myofascial release body work I was doing, and the energy of access, this brand new thing that was the coolest thing I'd ever found, ever. And I put them together, and I remember the room just kind of, everything got white for a second, and it was huge. And that was 14 years ago. And I started doing it. And over the years, I have, this class, this energetic manual therapy has been created from that work of me adding the tools and the processes and this awareness we get and these questions we get access to this manual therapy work I love.
Yeah. Now, you have a doctorate but you had that before, but you just got another degree of some kind.
Oh, I had a master's degree in physical therapy, and then I kind of did what I call an upgrade to a doctorate in physical therapy. So it's in the same field. Yeah, I did that a couple of years ago. It was something that was offered to therapists who had the master's degree. We could do it in less than 2 years, and I added that into my life, which was actually really fun, because I went back to when I was a little kid. I wrote in this book one of the things I wanted to be when I grew up, and it wasn't an option back in those days for girls. It was on my brother's. My brother had the same little notebook thing, and he had doctor on his, but we didn't have it in the girl one. We had like nurse and mother and teacher. So I wrote in doctor when I was like 5 years old, and I saw that years afterwards, and I was like, wow, I asked a long time. So ask and you receive, and you never know when it's going to show up or how it's going to show up, but it actually does show up.
Right. And so, the thing I love about this is that you never stop. You never stop this conversation with bodies that you've been having for years. Yeah. How many clients, I know you don't count them, but how many bodies have you worked on?
Well, just with the classes that I've taught, probably thousands and thousands. Thousands of bodies. I've done.
And you've had a practice of your own, though, also.
For many years I had, I still do have a practice. It's just I don't have an office anymore, so I see people out of my home because I travel so extensively teaching the workshops that I am not around to have a regular clientele. That is another ask for my future, is to have a practice that runs itself with fabulous practitioners trained in this work.
So EMT.
Yeah.
EMT, energetic manual therapy.
Mm-hmm.
Yeah. The energy is in the name, and it just excites me. But can you tell us what that's about?
It excites me too. It was a name Gary Douglas helped me come up with.
I got it.
Please shut up.
a baby too on the chat. I've got it. Go. I'm sorry.
And I have to unmute me. Okay, there. I'm back on too. Thank you, Kass. So energetic manual therapy. I love this name. I looked up all the words of the name right after it was like light that was going to be the name this was. And energetics, I looked up, and that's actually really cool. It's the study of energies, which I was like, wow, that's what a lot of Access is. I don't know, studying, learning, awareness of energies. So that's a big part of the class, is how bodies communicate, how they talk to you, how do you listen, how do you have, change how you are with bodies so you can start listening in a totally different way, and how do you access what you already know. That's a huge part. I would like people to come out of this class with a more ability of how they work with energies and bodies and how that contributes, and having an awareness of what contributes, what doesn't, what's true for you, what's true for the bodies you work on, and the questions you can ask to start accessing that, because everyone has amazing abilities. All the years I taught the 3-day body class, that's one of the things that class, the 3-day body class, which Kass, you also teach, allows you to start to access the abilities and capacities your body has. So I have that energy in this, like what capacities with bodies and energy do you have available that you've never tapped into, that you've never been asked about, and what have you been using that's been so phenomenal and you've really not acknowledged it. And then the manual part, energetic manual, is our hands. So you get to work with your hands. It's hands-on body work, which I adore, love, and obviously I've been doing it for so long, I must love it quite a bit. So you're going to be shown some really amazing skills, techniques, really basic, fundamental bodywork techniques to access the fascial system of the body. And what's the fascial system? It's this amazing connective tissue that's really everywhere. It's around every cell, molecule, nerve, in your DNA, around your DNA, out to your cell walls. It makes up the big connective tissue like your tendons and ligaments. So it's everywhere. And by accessing that, or the energy of what that is, you start to work on in a whole body. So it's really different than a lot of bodywork techniques or modalities, because it's really working on the whole body and allowing you to have access to that. So that's the manual therapy. And the first class is the one that I'm teaching right now in the next couple of months, is the fundamentals. So energetic manual therapy, the fundamentals, and there will be an artistry class that will be the more advanced, that will give you more information. So that's the energetics, the manuals, and then therapy I looked up, which was one word that I was like, therapy sounds so this reality. And I looked it up, and it's an ancient Greek word that means to care for and to nurture and to be of service to. And that is a huge part of what I would like people to receive from this class, is that ability to touch bodies with caring and nurturing and honoring. So that was, I just love the name. And EMT is kind of fun. So that's kind of a brief overview of what the 3-day class is going to offer.
Yeah. And what does it look like, the class? I mean, I've hosted you for years with the Access 3-day body class, and then you made me 5 or 6 years ago get my own license. But I've also hosted years ago this Maya Fascia class. And one of the things I love is your ability to empower people to step into that. So what does this class look like? I mean, you've also done the SE classes, you've also been a therapist. What, all of that mixed together, what does this class look like?
Well, it's funny because every class is so different, because it's the participants that really make the class. I start every class, like many of us in Access do, if you could get anything out of it, what would it be? And that really creates the class. So what people, where are people coming from when they show up? What do they already know? What do they want to know? And what questions and what do they want to change is what the class looks like. But structurally, it's 3 days. We ask a lot of questions, and we have a wonderful conversation about how different bodies are from an Access point of view, which is one of my favorite parts. And then we trade these processes, the body work, and I'll do a little demo, and then you pair up with people and you work on bodies. And so you get to receive amazing body work on your body for 3 days. And, I've had I think 1,000 people or more come to this class with me so far. And no one has left without having a change in their body. What the fascial work does is really creates a softening, more elasticity, more like I like to call it a bounciness. So your body's, as we sometimes with points of views about aging and old injuries and surgeries and all these crazy things that we do to bodies, gets more solid. And also points of views are huge at creating solidities in bodies. That's really what a fixed point of view or decision does. And we will look at uncreating a lot of those energetically, and then go in and work on the body. And I show you how to find the places that are more solid, how you can feel them, and how you can get feedback from the body you work on to find these places. And when they open up, when they become more elastic or more bouncy, like I like to, this is what I say in class, if you've ever picked up a baby, they have like a bouncy quality to them, and we should have that our whole life. So that's the target with bodies, is to have that lack of solidity and this really bouncy, soft, flexible bodies that we can have. So what I found that people, the feedback I've gotten, which has been incredible, is that people who've never worked with bodies, maybe they've done possibly the body classes where it's energetic and you lay your hands on, but the working, manipulating bodies, they've never done it, and they come out of it trusting that they know how to do this. And the stories
Right.
of people working on people are, they just like, oh yeah, someone had back pain. I went, well, let me try this new thing on you. And the person receives 15 minutes and doesn't have back pain and never needs a chiropractic adjustment after that. Incredible change that you can get in 3 days out of this class. And there's quite a few people that have just started practices from the 2-day class that I was teaching with. It was Essie for Bodies. And they're actually have practices just doing the work from what I showed them in the 2-day. And there's more in this class. It's longer, and there's a little bit of a different conversation going on too.
Right. And there's a word that you haven't said, but it's sort of coming up for me. You did say the manipulation of bodies. It's technical too. I mean, right? That's the word that comes up. It's technical. It's actually the fruits of your work as a therapist, as a physical therapist, that you're gifting to us in this class. Am I making that up?
No. None of the technical skills, and I like to call them skills more than techniques, because they are, the way I design them is that you can use them in any place in the body, and I really show how you can take these 3 or 4 ways that you can access the fascial system and take it globally on a body, I guess. So there's some specific things that, working on specific areas like the neck and stuff that I show you, and cranial sacral work that I've found over the years. Like I trained quite a bit in this, and used to be an instructor for the myofascial release courses years ago. So the ones that I found create the greatest results on bodies. And in this class, this 3-day, it's fundamental. It's an introductory class. It's really things anybody can do. I mean, kids have taken the class and they blow my mind. So nothing is so technical that you need to have studied anything anatomical beforehand. If you like that stuff, I can give you websites to go to and study more anatomy. But I actually find that people that don't have a medical background or body workers, receive differently because they don't have the points of views of how it should look. They don't have answers about the body. And getting rid of our answers about the body is one of the greatest ways to start creating something that's beyond this reality.
So we could come to this with a clean slate. I mean, there are no prerequisites for this AMT class, which is just delicious.
It is. I highly recommend a bars class or a body process class, though. If you've just had a touch of the access processing, what you can receive exponentializes, but it's not required. We'll work with it. And
so you give us an introduction to energy, right? You give us an introduction to the magic of our hands and who we are, and also how the many different ways you can hear a body, listening to a body. But I've been in your classes before, and the different way that you hear them is so without any filter, that it's so such an invitation. Is that a skill, or is that something we all have? We just have to get rid of some of our points of view to access it.
My point of view is that it is something everyone has available. Absolutely. I've never met anyone that doesn't. And yes, our filters, it's a muscle you build. I've been doing it for a long time. One of the things is I don't want people to look at me as the one that knows how to do it, because it's really, everyone has access to it. And teaching this class is about having this body work everywhere, having as many people as possible. One of my targets is to have this access to being able to touch bodies with these different this different way without a point of view, with the being the question of what's possible with bodies. So yeah, everyone has access to it. Some people have a lot of fixed points of views, and that's okay, because we all come in with fixed points of views. I mean, that's how this reality works with bodies. We have decisions and definitions about what bodies are. We can even do a clearing right now. So everyone, all of your definitions about bodies and what you have decided bodies are, that they are not, could we destroy and create all of that?
Yes.
Right, wrong, good, bad, pod, poc, all nine shorts, boys, and beyonds. And it's really about being out of control with bodies, and you're not controlling them, and that's where the magic lies, when you can get into the chaotic places and change from there without your points of views. You get way more change. And what the bodywork techniques are so awesome. They create so much that even if you have a billion fixed points of views and a million answers with bodies, you're still going to get change with the techniques working with bodies.
Yeah, and it's so matter of fact. It's what we access empowering, because you absolutely do empower people to know what they know, right? And that's really cool. If anyone has any questions, you take a lot of who you are for granted, but you talk to us about myofascial release, you talk to us about craniosacral, and you gift all of that knowledge with such ease in the classes, and we take it away, and that's awesome.
And you get to play with it.
And we play with it, right.
Yeah,
and
you
don't ever have to do it. You don't ever have to go out and do it, but it becomes part of your body of knowledge. So if somebody requires that, you've got this kit. And I believe there's a manual that comes with this class, or am I wrong?
Yes, there is a manual. I love my manual. I've got beautiful pictures. It came together totally with ease, and there was a photographer over I was trading bars with, and I said, hey, why don't we take some photos for the manual? And my daughter was there, and I was able to talk my 14-year-old daughter, which it's not easy to talk 14-year-old teenager girls into anything, to be my model. So there's beautiful pictures of my daughter in it, and me demonstrating the techniques and a little description. So yeah, it's in the manual you get a lot of the skills and techniques I show that are pictures of them, so you can take that away if you can't recall everything. You also get recordings of the class, so you'll have that. You do not have to do this as a practitioner. 3 days of this body work will change your body, and people come just for that, just to receive the class.
So please, if you have any questions, come off of mute, or you can put them in the chat and I'll read them. And I will just ask this question. You said that there's going to be an artistry class.
Yeah.
So after these 3 days, which have no prerequisites, one will be a practitioner of EMT,
correct,
right?
Yes.
An operatore, as we say in Italy. And then eventually will be an artistry class. Will there eventually be the possibility of teaching this class in the future?
That will require a lot of prerequisites to actually teach the class. I'm looking at what that is going to be, and to teach intros, what that's going to be. It's not really, I need to get some people through this class and get an idea of where people are, but the artistry class will have more prerequisites. I'd like to have it through Maestro, but that's probably asking a lot of people. Because that may be the uber advanced class at some point.
Yeah. So I know you have lots of classes coming up. I know you're going to Ecuador. I know you're going to Amsterdam. I know you're coming to Vienna, because I'm going to be there too. Have you done your homework? Do we have other classes coming up that you can tell us about? And we will definitely send out that information with the recording of this Zoom to people too.
I did, at the very, very top of the chat, I put in my access website access page, where you can see all the classes I have around the world. I have a fabulous tour coming up. So you mentioned Amsterdam, Vienna, Ecuador. Ecuador's next weekend. I'm so excited to go. It's right by the Galapagos Islands. So I'm Guayaquil, Ecuador, and Osaka, Japan, and
awesome.
Delhi, all in October and November. So there's lots of places to choose if you want to jump right in. Yeah, that was a question in the chat.
Awesome. So it's accessconsciousness.com/Dr. Glenna Rice. No points in there.
Yeah, Yeah, so if anyone has questions about anything about bodies or whatever, I'm happy to talk about any of that. I know someone said it
Right.
for me. I think that's exciting. Maybe my practice.
Somebody's asking about the exact location of the class in Vienna. We'll get the Vienna host to tell you that, and that's in the chat there.
I
And
wrote it in the
Australia,
chat.
somebody's asking, when are you coming to Australia?
Yes, I have been asked, and the scheduling hasn't worked well yet. Hopefully this year. I'd like to come in the spring. Absolutely. I love Australia. I haven't been in a few years. So I will,
Awesome.
that's definitely a possible class this year. Yeah.
Okay, just looking to see if you don't know how to put up your hand, that's fine on the Zoom. You can just say, hey, I got a question, take me off. Anybody have any questions about bodies for Dr. Rice here?
There's someone coming.
Is Canada on your radar? Somebody
Yes.
says.
Yes.
They just want you, that's it. This class will be online too. This class will be online too is a question. I'll let you answer that.
No, it is not online. It's not really possible. I'm doing hands-on with you too as you're learning, and I go around and I have assistants. If the class is over 20, 30 people, I bring people on to assist me with being out on the floor when you're practicing the different skills that you're learning, so you can get some feedback. So I can't do that online. I can't come into your house and do it. I might have some, Zooms like this where I show some techniques, but it's really something you need your body there. I'd love to do online, and it's just not something that could work with this work.
That's probably the M in EMT, right? That manual thing. It's not about the book. It's about your hands on the book.
Right. Yeah, I've looked at doing that, doing Kajabis or doing continuing ed courses for physical therapists with this stuff online. What else is possible?
I'm going to tell you, most of the questions are not about the bodies. They're about when you're coming their way. So the end of March in Australia would be great. Hi, Glenna, are you aiming to come to Ireland sometimes? Can a person be a practitioner after this class?
Yeah.
Okay. Question?
Yes, Ellen, go.
Yes.
Let me just say, you are a practitioner after this class.
Yes, you are a practitioner. You can use this. You can say you took the class. You can call yourself. I do recommend that you treat, I think I'm going to go with 50 people till you really start calling yourself a practitioner, because you build a muscle the more bodies you touch with this, and they teach you, the bodies teach you how to do this, really. Go ahead, Ellen. Yeah.
I was a little bit late, so I don't know if that question you already answered in the first quarter of the hour. But what can people get the results out of the EMT and what's the difference with the ESSA class?
Yes, that everyone asks me the difference. I don't like going into the difference because we're really trying
to... Not the results. What are the difference in the results from the EMT and the ESSA?
The results are really varied. I can't say specifically for each person because it's really different. A lot of the solidity in bodies are going to change with both of these works. I mean, the SE class, now Susie Godsey is the founder, creator of SE, and I was teaching the SE for Bodies class for about 3 years. Now she is, after many years of not teaching it, which is really, really exciting, I think, that she's now teaching this class. And what she's added to the class and what she's created, you're going to have to speak to her, really, because I haven't taken her class with her. But the SE for Bodies I taught for 3 years, and this class is an extension or expansion, an upgrade, an updated version of that class that I was teaching. And I'm speaking to all the energies. And she's now creating on the planet with this class, which I think is such a gift to everybody, because now you have, where you only had one class, now you have two. So we have more to choose from. And it's really about what your body wants to choose. And every facilitator of every access class has a different energy that you're drawn to. And you can take both. When I meet someone that's taken both classes, with Susie and with me, I will ask them these, and then I will have a better answer to give people to say, what is the difference? I mean, I watched Susie work on horses for years. We taught the horse class, SE for Horses, the extravaganza together, and she's extraordinary with the horses. And the work has a similarity. I mean, I do know that we both work on bodies, like in private sessions, in a similar way. And is working with fascia, but her work is now changing into what she does more. And what that's going to be is going to be what she creates.
But the question was not about the difference between you or Susie with Essie, but the difference, the people get results out of the class. And I got nice results out of the Essie, but what are the results you hear from people out of this new class?
Okay. Well,
Bounciness.
Bounciness. I mean, pain is going to completely change. The flexibility of your body will completely change. People walk different after the class because they have more movement available. There's a lot of movement possibilities that change. Mm-hmm. With some of the clearings verbally about this, how we've solidified things and our points of views, but also that when the fascial system opens up, so the fascial system supports and creates all the structure of the body. It's like your bones are kind of floating in this fascial system. And if it's hardened down like hard ropes, it pulls things off of alignment. So your alignment and your structure is going to be more flexible and more functional, is one of the things I like to say. I work a lot with scars. It's one of my favorite things. So people with scars have had the tissue around the scars completely almost disappear where they can't actually feel it. Back pain, neck pain, those kind of things. There's a lot of, and we talk about pain because pain is truly an awareness your body is giving you, and a lot of the conversations in this class are about pain, especially if you're a practitioner that's been working with bodies that come to you because of pain, having a different point of view about that. So if you don't have a point of view and you know it's a conversation the body has, you can offer clients something completely different that I don't know of any other modality that actually has the same point of view that Access does about pain. So that is you're just gonna create something different with people that come into you with pain. Unless they don't want to change anything, they'll still feel better though. I've had many people that had no interest in changing, many clients, patients over the years that didn't want to change what was going on with them, but did want to have more ease with it, and their pain decreased. It didn't go away because that wasn't what they were choosing, because it was valuable to them at some level. And what happens when the fascial system opens up, all of your body systems, all the organs, everything starts to function at a greater level because they have the ability to get nutrients, blood supplies in and out, nerves function better. So your whole body can stay younger, is what I like to say. I mean, that's what mine feels like when I get this work. Is that help, Ellen, or is there something more specific?
No, thank you. That helped me. Thank you.
Okay.
Yeah. And this is a 3-day class, which is a little different also. Yeah. I get, and one of the things that is so wonderful about these tools of Access, that when we combine them with anything, an apple, an orange, yes, they're both fruit, right? And they're both nourishing, but it actually shows up in a very different way. So it's exciting. And Ellen, I know that you love bodies and bodies love you. Mm-hmm. So it's totally exciting to for people who would like to enlarge, and their menu, their body menu, and receive more information from their bodies and with their bodies. So not only do you get worked on in this class, you also have the takeaways. Your body's more flexible, it's more bouncy. You less solidity, all the points of view, you talk about that a lot, but you also then are able to offer that to other people. So that's awesome. Yeah.
We have a great question that just came in. I have 34 years. I'm a child neuropsychologist. I have cerebral palsy. How EMT helps me with this? I worked with children with cerebral palsy for about 6 years in a school district in Boston, Massachusetts, back when my babies were little. And that's when I first was introduced to the myofascial work. And I was skeptical of that. I did come from a real serious medical background. Energy work. It's funny now looking at it because I was doing all this stuff anyway and I didn't realize it. But I was very into the sciences and the answers, and what I found over the years is that what I do now works so much greater than the stuff I was doing before. Adding the question, and the kids with cerebral palsy responded incredibly well to the work then. And I've had a few clients now, and I just had someone in a class in Mexico last month who had cerebral palsy since she was a young girl, or at birth, obviously, and she was able to move her hands together for the first time in her life. Actually, there is a video that is up on YouTube. If you go to my YouTube channel, it's Essie Hands Dance with Bodies, that she shows the difference after the class. I didn't videotape it before. And she was able to raise, so that she had tightness in her body from the years of having this diagnosis, whatever that is. I hate diagnoses are such an answer that they actually, that answer creates some of what's going on. So we changed some of that, and she was able to access the movement of her body and walk without a limp, which she'd never done. It was pretty incredible to see the changes. So what's possible? You know, I got to work on a lot of kids and adults, and they have to come to my classes, and I can talk more about it. I think any change is possible with the body. And many kids with the cerebral palsy have lots of surgeries, so they have a lot of tightness in those areas, lots of projections throughout their whole life of what they can and can't do with their body. All of those things create how the body functions, how the body moves, and this class can help undo some of that. And then it's really a choice of how much you want to change, what you're willing to change, and what's possible and what your body can create. That would be, that's my future practice is is having those kind of patients come in with this work and see what's possible.
Right, and I do suggest you bring your questions because, you know, Glenn is a wealth of information. Someone was asking about seniors and how the work might benefit seniors.
Absolutely. Yes. I have 2 seniors that live in my house. My parents live with me. And I've worked on them many times. Yes, the body, this works on, you know, newborns. I mean, to get this work the first day you're born would be incredible if everyone can have a minute after we go, you know, our heads go through whatever, get smushed, and after being in a tight womb for a few months, to get this work right afterwards is incredible. And I've worked on babies right after they're born, my own. My youngest I did. And up until whatever, I worked with in home care and nursing homes for years and did this work on people. So there's no time limit for sure. And you can get incredible change at any age.
We have a list of questions over here, Glenna. So somebody is asking, does manipulation of the fascia help correct spinal challenges? Can this be used on weak eyesight?
Can we do it on ourselves? And is it work with spinal? Yeah. Yes, I have had many patients with scoliosis that have come in. It's actually, this work has been researched, the myofascial craniosacral part of this work, not the access part. The questions that we add to all this, but it has a lot of published papers, and that is one of the papers that published is someone with scoliosis, case studies with that, and I've seen incredible change because you loosen up all the tissue around it, and the spine can start to align itself better. It depends on how the age and how long they've had it, and if the actual structure of the bones have changed with the scoliosis. But I know that can change too, because bones are fascia and also can change shape and form with this work, and I've seen that happen many times. I've seen bones align themselves when they were broken. I've had before and after pictures of someone that broke her leg, went to the X-ray, went to the orthopedist the next day, and he had worked on her in between through the cast, and the doctor was completely surprised that it was totally aligned. So it really, there's not a limitation to what the body can do if we're willing to choose it, and this is some more tools to get us there. You know, this is not an answer for every problem that shows up with the body, for sure. Some things that the access body processes are better. Some things going to the emergency room are going to be better for the creation. It's like you have to be in the question, what does the body require? This is something that will create a lot of change for a lot of different things. Is there another question, Trudy?
Yeah,
so there's...
Okay. Is this on the chat that we're looking at, or a different one down? Go ahead.
I think she's up higher.
I'm sorry, Kass. Yeah.
No,
So there's
ahead.
another question. This lady is asking, my whole left thigh is numb as veins are cut, as I have 2 surgeries, one for tumor just below the knee. Does this work help with releasing the nerves that have been cut?
Well, I've had a lot of success with that kind of stuff too. The cut nerves, anything that's cut or with surgery or injuries is going to create fascial, what we call restrictions or adhesions around it as the scarring and the body heals. Now, if you don't have, what I found is if you don't have a point of view about like it's the injury or the surgery, like if you don't go in scared of the surgery or the a lot of trauma around the accidents, which is really rare that people have that. But what I have seen people have surgeries that I worked with before the surgery that came out without a lot of the, residual effects of the surgeries, these tightnesses and these other pains that show up. It's rare, it's possible, and this work can totally change how the tissue is around it so it can heal in a different way. So it doesn't have these limitations you're talking about. And sometimes with surgeries with cancers and stuff like that, there's other things we have to look at, like, what was creating that, your points of view around the surgery. Like if anyone that's diagnosed with cancer usually goes into some kind of a beyond that is going to contribute to how it's going to be created in the future. So if we can change those points of views, you can have a lot more success with what you're looking for and what questions you're asking. Cool.
Again, somebody, just as you mentioned, Glenna, that it does help with cancer. So somebody is asking, what about cancer patients? Does EMT help cancer patients? So
well, let me be really clear. It doesn't necessarily make cancer go away. We're talking about someone who had surgery for cancer that has scarring from the surgery. Cancer is a totally different, I'm going to say bag of worms, or I don't know. That requires a lot more questions about what the person's creating, what the value of it is, if they can even go to that point. So no, the way cancer is cured is people changing their points of views about it. You have to cure that. No one can cure your cancer for you. I'll be real clear. There's no work that can do that. That's something that, but I've seen cancer change, go away many, many, many times. I've had breast cancer patients that came in with work for me, and we asked lots of more access questions and some of the body work that went into remission and have never, 10 years later still are cancer free. So cancer can change. I know that. There was another question with that.
There was a question about eyes, if it's actually our eyes made up of fascia.
Well, not the liquid part, the inside, but yes. And you can work right on an eye with the eye closed, really closed. I don't teach that in this class. That would be more for the artistry class. But you can work around the eyes, and there's cranial sacral, or we work on the face and the head in the class, and you can use some of that. And there is the eye processes from the Access Body class that I highly recommend if it's something about vision. But I've seen people that had like a little bit of a cross eye that this work helped straighten that out by loosening the side that was tight. Those
Right.
are, in the details, we go into how that all works in the class. I don't have time to go to.
It's also interconnected too, so that, right, that when we're changing something in the body that we may not even know has been stressing the body. And that's what you give us access to in those classes. In these classes is following your knowing on an area of stress in the body that you can help release, and what else can change is miraculous, right?
Yeah, and because the way we access the fascial system, and I speak about it, you're working on the whole body. So anywhere you work on the body, you're working everywhere else. So something that could be going on with your face, it may be actually your abdomen or your shoulder that gets the bulk of the hands-on work that changes to something else, because everything is connected. With the fascial system, just connects everything.
And what doesn't that, the points of view too, somebody's asking about that. Clearing points of view about bodies, is that part of the class structure?
That is a huge part. That is the class structure. I mean, right? Because if you have no point of view and you have all points of views available and none of them are fixed, then what is possible? And those of you who have done some of the Access classes know what I'm talking about. And some people may be new on this Zoom that have never had any. So for those of you, I would go to the accessconsciousness.com website and check out all of the material, because there's so much free stuff. There's stuff on the internet. There's lots of videos that talk about what this work is. And I will, we will talk about that in class, depending on if there's people that are new.
And you have some of that on your website too, don't you? Where can we find more information about Dr. Glenna Rice?
GlennaRice.com is my website. It's actually old because I'm making a new one. Which, what would it take to be out in a couple months? My new one will be drglennarice.com. But Glenna Rice.
All right. And YouTube, you've got some stuff on YouTube?
I do have some, and there's some great videos. There's some that were on SC when I did some videos there, and that talks, I mean, this is a similar conversation to this. You can watch any of those or some of the new ones I put up.
Great.
Yeah.
Can I ask you something?
Mm-hmm.
Yeah, someone asked if this process is based on the same energetic process of body process, access body process, body works, or if it's a new thing.
The access body processes are part of this class, and I do have, I think, 4 body processes that I have in the manual that create results with this. Not every one of the body processes works well with this work. I tried them all because that was the first thing I did is I took the body process manual and all the energetic processes. And for those of you who aren't familiar, there's these like 50, 60 different processes in the 3-day body class that are hands-on energetic body processes. And some of them worked dynamically. Like I would be working on a fascial restriction, a scar, or something going on with the body, and I would turn on the energies of let's say cellular memory, which is something that allows injuries to go to your cells to go to a pre-injury state. And I would feel the energy of the body changing with the work I was doing. Now, other ones I would turn on and nothing would really change. Like it wasn't a huge contribution, or the change wasn't as dynamic with the body I was working. But the ones that I've added in are the ones that I will use often when I'm doing a body work on the fascia. So yes, they contribute. They're part of the class. The energies of the body classes are, I mean, I've taught this class for 8 years, probably 20 classes a year, something like that. So it is part of what I teach, and the energy of that is always part of me, when I'm working with the body. So it is brought to the class. But there are some specific ones that I love to use when I'm doing this work that I have in the manual.
Yeah, that's it.
Thank you.
Yeah, that's Valeria. Do you have another question from the Italian group?
No, this was the only one.
Okay.
For now. Thank you.
Yeah, go ahead. Is it Renata? Renata.
Hi. I took your introduction to your class and I was really impressed, and I tried in person. And I'm trying to put that into work, and I am, like you said, also working with some processes like cellular memory, or what can I change here. I ask the questions from Access, but I am connecting, I'm asking to connect to the fascial system. Mm-hmm. And it's amazing what shows up. It's amazing. So thank you.
I can see you doing it with your desk right now.
Thank you. I want to ask you a question. Maybe you can help me. When I'm introducing my work, either Access or your work, to new people who are not aware of Access, when I start saying this is healing through energy, through touch, people say, oh yeah, I had Reiki. And I'm like, no, this is not it. And so would you help me to explain? Maybe I'm not explaining it better, because I did not study Reiki, but I know the connection to fascia and stuff, but I don't, maybe I'm not explaining it right.
Well, this is always difficult with Access work or anything you do, even if I'm sure Reiki practitioners get asked questions about, is this like Access or something, or some of their energy work. I mean, people are always trying to come up with, people either want more information or they're trying to come to conclusions,
right,
to not get the work. Like they've already decided it's something. So, ask them questions. Say, oh, you had Reiki. That's wonderful. I haven't experienced that. What was that like for you? Was that helpful?
Okay.
And you can ask them questions about what they want to change with their body and say, well, we can give it a try. This might help you. What do you get? Put the questions onto them. And if they're not really curious, they're not curious, There's 7 billion people on the planet. There are people we can see that do want this work. There are not enough practitioners to possibly work with the number of people that will want to choose this in the future.
Okay, I got it. Question. Thank you.
Question. Yeah.
And that's awesome, Glenna. And for me, that's one of the magic of your facilitation. We've co-facilitated together. And as I said before, I've hosted you. But that giving people the assuredness, the comfortability with handling questions and approaching bodies is really quite a gift that you have. And for me, one of the differences of your classes, and I feel like we're getting a little bit of this, a little bit of body class, 3-day body, a little bit of essay, a little bit of therapy, a little bit of manual, a little bit of energy, a little bit of everything, and adding to our bag of tricks. How did we get so lucky?
There's a song, a little bit of in
a little bit of Glenna, Dr. Rice. Okay. Yeah. Anyway, I get a feeling this is the last Zoom that we do, and about this. And I just want to see if our friends from Israel have any questions. Lizzie, how you doing there? Just to give them a chance. And any of German friends have any? Natalia.
We're waiting for questions. Like, I just like to say, Renata came to an intro night in LA. I think that was the one you came to. I'm pretty sure. I'm recognizing you from the Zoom, which was just a 2-hour. And wow, you're out there applying work to your practice from that. And I could see the energy of you, that you were being this energy of connecting with the body with this energetic way with your hands and the kindness of it. And I'm kind of blown away that in a 2-hour class, you received that much.
I am asking the question, what energy, space, and consciousness can I in my body be to access the fascial system of this person with a greater possibility in the stuff you were teaching.
I love it. I love it.
I'm running, and see what else.
Yeah, I think someone else came out of that intro and worked on someone who was like, I'm just going to try this thing Glenna showed in the class. And she put her hand on an ankle and a hip, and the person was, actually, she just talked someone through it, I think, on the phone. Wow. And they were like, what did you just do?
Yeah.
So the empowerment for bodies and the possibilities you guys all have of doing this gets me so excited. What if there were 10,000 people practicing this on the planet, practitioners? Like, what would change with bodies? Because bodies will not be the same. You will have a different access to them after class.
That's amazing energy when you ask that. I just want to give a little technical information. Translation is always possible in a class. If there's 2 or more people, and Glenna will always, and I'll help her if she doesn't find a translator for the language you desire. So again, she's going to Japan, she's going to Ecuador. Obviously, there'll be Japanese and Spanish there, but there are other languages possible, to Amsterdam and to Vienna, where we already have about 4 languages, right? It's the 3 days following, and I just say this about Vienna, and we can cut this part. They're 3 days following the ABC, the Advanced Body Class with Gary and Dane, in the same city. So that's quite easy for people. And Europe is quite easy to get around. Amsterdam's before that. And Japan is a direct flight from a lot of places. So choose where your body would like to get these beautiful gems. and head there. And Glenna's got a lot of fans, me included. So I know Soren will be there. And if we can,
he's helping out.
Those will be my partners from the last class I did with you. Yeah.
Kass, I'd just like to thank you for putting the Zoom together and everything you've said and the way you've been speaking about the possibilities of the class and what you got from it. I just like everyone, like years ago, Kass came to a strange little introduction I was doing at a 7-day in Costa Rica. She kind of popped in and she said, I want you to teach this stuff you're doing. And I was like, ah. And it was something I'd been asking. Obviously, you guys heard at the beginning where I put the 2 things together. So I came out to Italy. She was the most amazing host. She took such good care of me, and I taught this. It was just a 1-day introduction to the work. Didn't have a name. I think it was what we called it, What Does the Body Know, or something like that. So it was the start of the class that this is. And I'd just like to let you know how grateful I am that you pushed me, asked me, and supported me years ago in creating what this is now.
Yes, I follow my knowing, and I know excellence when I see it. So party on, dude. Thank you.
Yes.
All right. We're going to end the Zoom. Thank you all so much for signing up. Please tell your friends, tell everyone, no prerequisites. I don't know how long that's going to last, but jump on it. And we have already Hebrew excited about translating Italian, German, of course, and Spanish, and in Vienna, and then in Amsterdam, I'm sure we have Dutch, and yeah, and then what else is possible for consciousness with bodies and energy and manual manipulation and bounciness for all of us.
Bouncing body with dancing hands. I think that's kind of
it's only certain parts of my body that bounce, but that's another thing. We'll talk for it all to bounce.
Thank you so much.
Dr.
Thanks
Rice.
everyone that came on. Wonderful chat, and I adore you all. Maybe I'll see you somewhere in the world.
Thank you.
Yes, thank you. Bye-bye.
Thank you.
Thank
See
you, everyone.
Bye.
Thank you.
Thank you.
everyone.
Bye bye. Thank you, Glenna.
And-
Thank you, guys.
Glenna.